Okay, so thank you very, very much for joining today. My name is Dr. Fatima Kapasi, for any of you who don't know me. I'm a family physician and I work primarily, I have a clinic in Brampton, and I focus mostly on women or women's health in general. So I have a lot of pregnant patients, I deal with a lot of postpartum stuff, a lot of mental health, and everything in between. So the main aim of today's talk is to just go through, what a period is, what the menstrual cycle is, in general, problems with periods, just so that kind of you're aware of what's normal and what's not. Because even in my practice, I found that a lot of people don't actually know, what's normal just because that's what they've been going through. So that feels normal to them. And it can really affect a woman's quality of life or their function on a day-to-day. So I'm hoping that at least the take home from today will be kind of, is my cycle normal? What to expect? If you've got any kids, then you know what kind of things to think of. And then we'll go through a couple of conditions, okay? So let's get started. Oh, and the other thing as well is just an aside. So this is now the eighth talk in our health series. This series was all about hormones or women, like so issues that pertain to hormones in women. So we've spoken about everything from menopause, and the last talk of this series is going to be on puberty. So yeah, it's been great. I hope it's been helpful. If you do want to kind of go through any of the talks, they're all available online. So feel free. You can find them on the SBMAA YouTube page, and you can also send me a message, and I can send you the link if you want to. We're going to be starting our next series, inshallah, in October. I'll send more information about that too. There's a lot about preventative healthcare. There's a lot about mental health, and we've got some amazing speakers lined up. So uh, please stay tuned for that. Okay, so can you see my slides before I get started? If you can't, please let me know. Okay, and if you do have any questions along the way, please feel free to ask. Okay, so let's get started. So in today's talk, we're going to review what the menstrual cycle is. The menstrual cycle and periods are used interchangeably. It's the same thing. Okay, so we'll review what that actually is. We'll discuss the different phases. We'll go through some of the products that we can use for periods. This is particularly, I know, all of us have had periods before and we've been using products, but there are some things in the market that we might not have tried. So I just thought an overview might be helpful. We'll talk about some of the common symptoms that you can get with periods, and then when to go and see your doctor. So what's not normal, and then a few of the very common conditions that we get with abnormal periods. Okay, so what actually is the menstrual cycle? So the reason for this picture is just to show you in relation to your body where exactly the uterus is. Of course, it's not an accurate picture. The uterus doesn't really look like a heart, but it's just really to give you a bit of an idea in terms of the location. So basically, your menstrual cycle or your period is the shedding of blood on a monthly basis. And there are four hormones that are involved in this process primarily.
Everybody laughed in class. It's
Um,
in class. Nobody.
okay, so the four hormones are estrogen, progesterone, FSH, which is follicle stimulating hormone, and the luteinizing hormone, which is LH. There are others involved, but these are the main ones. The reason for the menstrual cycle or the periods is to prepare the body for pregnancy, essentially. So if pregnancy doesn't happen, you get your period. If it does, then you don't. And we'll talk about that in a bit more detail. Also, interestingly, and it had never actually occurred to me until I was preparing this slide, but on average, we apparently go through about 500 periods in our lifetime, and that's a lot. That number did shock me, but essentially it's having a period once a month for about 40 years. It'll be less or a little bit more for some people, depending on how often your cycles are. But yeah, I was shocked by that number. Okay, this is a little bit of a heavy slide. It's basically the main phases of the cycle. I know there's four numbers on the screen, but actually the cycle has three phases. It's the follicular phase, ovulation, and the luteal phase. The reason for the fourth is just because the one that we experience is the menstrual phase. And so I've added that in, but it's actually a part of your follicular phase. So when you're in the uterus, all women develop eggs at that time. So you don't get any more new eggs after birth. Whatever you have are in your ovaries, which are these egg shaped structures on the side. And everything, like all the eggs that you have in there, is what remains. Every month, part of your brain causes the production of a hormone called FSH, or follicle stimulating hormone. And that hormone causes a few of these follicles that contain your eggs to go up towards the surface and start to develop. Out of all the follicles that do develop, one will become mature, sometimes maybe two, and that's when you can get non-identical twins. But generally, in most cases, it's one. Okay, so when that process all happens simultaneously from day 1 to 14 of your cycle. And this is in an ideal 28-day cycle. Okay, so and I'll explain to you the difference a little bit later on. At the same time, from the first day from day 1 to day 7, you'll be getting your bleed. So the first day that your period starts or the bleed starts is the first day of your follicular phase and the first day of your menstrual phase. And so all these things are kind of happening in the same at the same time. So your follicles are developing and maturing. One will mature, and then that one will start to produce a hormone called estrogen. So in the first half of your menstrual cycle or your follicular phase, you're going to shed your lining, right? Because you're not pregnant, and now the lining that was formed to prepare for the baby is shedding. In the second part, that estrogen, which your mature follicle that contains the egg has now started to produce, causes the lining of the womb or your uterus to start to thicken up again to prepare for the next pregnancy. Okay, so just to recap, there's two phases. In the first part, you're losing the old lining because you've not got pregnant that previous month. That can happen anywhere from 3 to 5 days, and that's considered normal. In the second part, of one of out of the follicles that started to mature, one will mature, and that one will start producing estrogen, which will then cause the lining to start redeveloping. So a new lining to develop, and your uterus will start to thicken again and to prepare for a baby. As this estrogen level starts to rise, when it becomes at its highest level, it produces a hormone called LH, or luteinizing hormone, in the brain. And when that hormone rises, it causes something called ovulation, which is where that mature follicle releases your egg from the ovary into those little wiggly tubes that you can see in its journey towards the uterus. Okay, so to recap again, FSH will cause some of the follicles to start to mature. One, sometimes two, will mature and start producing estrogen. The estrogen will start thickening the lining of your uterus, preparing for pregnancy, and it will cause the hormone LH to release the egg. Okay. Now, ovulation, which is what we call the process of your egg being released into the tubes, is called ovulation, and it happens on day 14. Now, it's not always day 14, and this is important because it is always 14 days before you start your bleed. Okay, so in someone, this is, as I said, in an ideal cycle where you get a period every 28 days. So between one period and the next, there's 28 days. That's on average. And so in that situation, for day 14 is the middle of your cycle, right? Now, if you have a 24 or 25-day cycle, or you have a 35-day cycle, the day that you ovulate will be different, right? Because ovulation happens 14 days before you bleed. Between your bleeding and ovulation, there's always about 14 days. So in that case, the follicular phase can be longer, but the luteal phase, which is day 15 onwards until you start bleeding, is always the same. Ovulation is also the time when you're most fertile. So it's the best time to try, if you're trying for pregnancy, that's the time that you're aiming to make sure that you're having intercourse so that your egg can be fertilized, because it only basically um, stays fertile for about 24 hours, and then it will break down if it's not being fertilized. There are a few changes that happen in your body as well to aid that process of fertility, but we can talk about that later if you want. Okay, so going on. So ovulation has happened on day 14 in a 28-day cycle. You then move on to what's called the luteal phase, and it's where the egg travels down the tubes towards the uterus. If if you have had intercourse and there's sperm there, it can fertilization can happen. And if that happens, that follicle that released your egg is going to develop into something called a corpus luteum, and it'll start producing more hormones, which will then keep the lining of the uterus going so that it can house that developing baby, right? Whereas if there is no fertilization that happens, that egg will continue its journey towards the uterus, but also the hormone levels will drop and it will cause you to start to bleed again, and the cycle then starts. Okay, so the follicular phase is variable. Ovulation always happens on the 14th day before you start your period, and the luteal phase is usually always 14 days. Now, what to expect? So this is of the normal things to expect. Okay, no one has the same period. It's always different, and there can be variations, and that's important to know because we always kind of worry, especially, in the early phases, there can be lots of differences in children, and then as we approach menopause as well. So the average age of menstruation is 12 years. So 12 years old is when most girls tend to start their periods. However, the range is from 9 up to even 16. Okay, so it can start as early as 9 and as late as 16. The bleeding usually lasts between 3 and 7 days. So if it's happening for less than that or more than that, then that's not within the normal bracket. The average length is usually 28 days, as I said, but anywhere between 21 and 35-day cycles are normal. And you can work out your ovulation day based on that cycle in terms of fertility so that you can work out when you're most fertile. The first 2 years of life, so menarche is when a girl will start her period. In those first 2 years following menarche, the periods can be irregular. Like they can get one period and then not get another period for a year. And that's completely normal. In fact, sometimes that can actually go on for a bit longer too. But generally, from 20 to 40, people tend to have regular cycles, of course, barring pregnancy. And then as menopause approaches again, or perimenopause, the cycles can become irregular again. There are lots of factors that will affect your cycle. Diet, stress being two of the most common. And by that, I mean, it can even cause you to miss periods often. So around exam time, either the periods will come and they might be heavier, or girls will completely miss their cycles. Even stresses that you're not fully aware of that your body is reacting to, because it affects your hormone levels, it will affect your cycle. And it's completely normal to have missed 1 or 2 periods. It's where when you're getting to that third period that you're missing, you want to get seen. Even sudden changes in weight can cause a temporary shift in your period. So don't panic if you've just noticed 1 month is not quite the same as your previous cycles. The color also varies. So it usually starts off with the brown spotting, very light spotting for a couple of days, and then usually 2 or 3 days of heavier bleeding where it's bright red, and then it goes back to brown as it tails off. And that process can take up to 7 days. The consistency and flow, so the amount of bleeding varies, but in total, generally the amount of blood that you tend to pass in your entire period is about 4 tablespoons. So it's not actually that much blood, about close to 70 mils or so. So it's not actually a lot of blood that you're losing. Now, period pain it's a big one. And for some people, they get period pain. For some people, it's just a little bit of discomfort, but nothing more than that. As long as it's not severe enough to affect your functioning. So if you're able to go to work, if you're able to go to school, just take medication and function, then that's expected. But if it's more severe than that, and you're finding, with your kids, like every month they're missing 1 or 2 days of school because of period pains, or yourself as well. You might have to take the day off work. You can't get out of bed. That's not normal, and that needs to be seen. Okay. Now, in terms of the period product, I apologize in advance if this is very, very basic, but I just thought it's useful because I know there's a lot of this stuff, and I come across in my patients that they haven't heard of all the different options, and especially if you've got kids who are approaching menarche, then it's useful for you to kind of just review this. Okay, so I'm not going to say everything that's on the slide, but it's there for you to see. The commonest is menstrual pads, and they can come with wings, without wings. There's different sizes. There's also reusable options for people who are, want to be more environmentally friendly. And actually, if you're thinking about that 500 periods in our lifetime, that's a lot of money, right? So reusable can actually be really cost effective too. The other option is menstrual panties, and there's so many on the market now. Basically, all it is a thicker version of normal underwear, and the idea is that it soaks up the blood and stops it from leaking. Um, Issues with that is that, obviously you have to wash them. You have to carry, it's bulkier to carry because you have to take a wet bag with you. You have to have spares with you, and sometimes they can leak depending on how heavy your periods are. But some people prefer these because you're not inserting any products in you and you're not putting any artificial products on. And actually you can use them with other products as well. Like you can attach a pad to it or wear a tampon with it or a menstrual cup with it. But they are more expensive. So initial cost is high, but then after that, because they're reusable, they overall can work out cheaper. Tampons are also very, very common. And it's basically a small, usually cotton-based device that's inserted internally through the vagina into the vaginal canal, and it absorbs the blood as it's coming out of your uterus through the cervix. So the idea is that it will absorb all the blood, stopping anything from leaking out. So it's discreet, it can't be seen, you can't feel any pads on if you're wearing it without a pad. And so you can swim with it. The problem with that one is if you've not got the right size, it can still leak through if you're having heavy bleeding. But otherwise, they're generally well tolerated. The only risk with that one, and it does happen, is something called toxic shock syndrome, where people forget that they have left it in. And so because of that, it becomes infected, and then it can cause very severe illness. You can get very, very sick with it. And there have been times when we examine people and then they've got a tampon in there that they'd forgotten about. Lastly, and this is probably the one that people are not as aware of, is the menstrual cup. It's a little reusable silicone cup. As you can see in the picture, some of them don't actually have that little stick at the end. It's just a silicone cup and you just bend it. It's really easy to bend and you can just insert it as far in as you can get it. And the idea is that it covers the cervix, which is where the bleeding comes out from. So it is internal. And so because of that, you can still swim with it. It's less likely to leak if you put it on correctly, and usually you can keep it in quite safely for about 8 hours, and it just collects your blood in like a little cup. The only tricky part is that you do have to take it out, so you have to put your finger in there to take it out, and it can be a little bit messy. And until you get used to it, it can feel a little bit odd. However, it is a really effective way to kind of minimize the products you're using, but also it's really clean because you do have to wash it thoroughly in between uses. It's cheap because the initial cost is all you're paying for. If you want to know more information, please let me know, and I can kind of go through some samples and stuff as well. But I found that's a really, really kind of up and coming method that people like more so these days. Okay, so let's go on to symptom control. So managing pain or discomfort, however severe your symptoms are. So as I said before, a little bit of pain is common as long as you can take over-the-counter medication. So ibuprofen or acetaminophen or Tylenol. If that alone manages your pain, that's all you need, then you're fine. That's normal. There are over-the-counter things you can do, like the ones I mentioned on here. But if it's more than that, if it's limiting your function, if it's affecting you more severely and you can't do things, you can't go out on that day, then that's a problem, and you need help for that. Okay, so the in terms of other than Tylenol and Advil, and I put the or ibuprofen, I put the doses on there. You can use warm water bottles. Make sure you're staying hydrated. Yoga relaxation actually helps. So does acupuncture. And the other two that are not as commonly known of, and they're both over-the-counter options, are magnesium. You can use 300 to 400 milligrams every day at bedtime. And on the heavier days, or when the pain is or the discomfort is even more, you can go up to 600 milligrams at night. And that can be really useful for pain. And the other one is thiamine, which is a vitamin B1, again available over the counter. And you can use that throughout your cycle as well, and it's safe to use. Okay. Now, PMS, we joke about it a lot, particularly related to mood swings, but there's a lot of symptoms associated because of that hormonal fluctuation that you get throughout the cycle, mainly estrogen and progesterone, the ones that are produced in the ovaries. However, the direct link is not as well understood, so there's more at play here with these symptoms. Most of us will get these symptoms usually just before the period starts. So in that luteal phase, that tends to be the highest time for when we're getting these hormonal surges, and so we can get these symptoms. Um, Again, with all of these, if they're mild enough that you're managing without it interrupting your day-to-day function, then that's normal and you can manage them as you have been. However, if it's affecting your functioning, it needs to be seen. And that goes with all the mood symptoms as well. If you're finding that you're getting so anxious or so low around that luteal phase just before your period comes, if it's interrupting with your functioning, there are treatments for it. There are, whether they're antidepressants, whether hormonal medications, but they are there, and there are actual medical conditions that can be diagnosed on the basis of your symptoms. So see your doctor if that's happening. Okay, so these are what we call red flags, or when you should actually consult a physician about your symptoms. So if a period happens before the age of 9, it's premature. So it's too early in a child under the age of 9. So it's worth seeing a doctor at that time. Or if by 16 they haven't had their first period, or if they've had breast development at least 3 years ago, but they haven't had their periods. Okay, so that could be, 14 or 15-year-old in that case. If they'd had breast development 3 years prior and they still haven't got anything, then it's worth going and getting them checked. If the pain, as I've said a couple of times, that if the pain is severe or the PMS symptoms are severe, or if after the time that they first started their period, if a child doesn't get a period for 2 years, they need to be seen. Okay. Um, this is in terms of the three missed periods in a row, that applies to everyone. So if you miss 1 or 2 periods, it's still okay to monitor. But once you get to the third period and you missed your third period and you've checked and you're not pregnant, it's definitely worth then looking into it. So any changes that you're consistently having for 3 months. So even if you notice your bleeding is very heavy, or you're getting all of a sudden you're starting to get very painful periods, you can still continue to watch it and log it. So getting one of these period apps is a really good idea, even for your child, so that you can log when the first day of the period was every month, because that will tell you what your average cycle is, and you'll be able to see if there's changes happening or if you miss periods all of a sudden. Okay, but yeah, three basically in a row missed is usually warrants a consult. If you're having heavy bleeding, so if you're finding that you're soaking through pads or tampons or having to change it every hour, that's not normal. Or if you're having clots. So generally big clumps of blood are not normal. You can pass small clumps and that's fine in the heavier days, but anything larger than about 2.5, 2.5 centimeters is considered too much. So if you're passing clots, it might just be worth just speaking to your doctor anyway, regardless of what the size might be, because it might mean that you're having periods that are too heavy, and then getting your blood checked to make sure it's not making you anemic, especially if you're getting very, very tired around your period time. That's definitely warranting uh, a, a consult. Um, okay, so that was basically about normal periods, what to expect, what to look out for, and when to seek help. There are lots of medical problems, some that don't have a diagnosis. It's just called dysfunctional uterine bleeding because we don't have a reason for why the periods are not normal, but it does need to be investigated. I've decided to go into a bit more detail with these four. And the reason for it is that they're very common, but they're also underdiagnosed. Often people have them for a long time and never actually seek help for them or might not really know what it is. So when you first hear the term, it might be quite scary. Okay, so I'll just go into a bit more detail about each of them. And please, if you have any questions along the way, feel free to put them in the chat box or, we'll have time at the end as well. Okay. So polycystic ovary syndrome, as I said, it's very, very common, and it's also known as PCOS, PCOS, PCOD. I think depending on where you're from, the words can be different, but it all essentially means the same, similar thing. So what tends to happen is it's usually where your ovaries are bigger than usual. They're heavier than usual because they contain lots of cysts. So they're usually fluid-filled sacs. And because they're already so full and bulky, they prevent those follicles that you want to mature every month. They prevent them from maturing and from an egg to get released. Because if the follicles don't mature, they won't release an egg and you won't ovulate, right? Which will then cause you to miss a period. For some people, it can be severe enough that they don't get periods on their own without needing medication. And for others, they don't get any symptoms at all and they're not even aware that they have it. As I said, it's very common. We're diagnosing it a lot more these days, but generally it tends to be picked up when people are trying to conceive and finding that they're not able to. And the reason is because it's if you're not getting your period regularly, you don't know when you're going to ovulate. And so it can be really hard to time when to have intercourse. So for anyone who has polycystic ovary syndrome, if you've been trying to get pregnant for 6 months and it's not happened, it's worth seeing your doctor so that they can refer you for testing or to a fertility clinic because we know that it can make it harder for you to conceive. But having said that, I've got a ton of patients with polycystic ovaries who do manage to conceive naturally. So it's not necessarily going to limit your fertility, but it can make it a little bit harder. So getting that advice and just being aware of it is definitely worth knowing. We often also see it in families. So, it might not have been diagnosed in moms or grandmoms because they might have not sought help, or it might not have, actually, they might have not realized that it was an issue. But if you go through some of the symptoms, you might find that there's a lot in common if you suffer from polycystic ovaries yourself. Often there are other medical conditions that are associated with it, particularly insulin insensitivity. So in someone with polycystic ovary syndrome, they're about 4 times more likely to get diabetes. And as Asians, we're more prone to diabetes anyway. So it's definitely worth getting blood work done regularly to make sure that you're treating this early, or at least you're looking out for diabetes or other health conditions. And symptoms tend to be worse in people who are overweight or obese because it makes it harder for you to lose weight. So you tend to gain weight more easily as one of the symptoms, and it's harder to lose weight and it makes your symptoms worse. So it's like this really difficult cycle to get out of. In terms of the symptoms, as I mentioned, so you can miss your periods or you can get very irregular periods. A lot of the symptoms tend to be because of excess androgens, which are generally considered the male sex hormones, although they do occur in women too, like testosterone. It tends to cause a lot of excess hair, mostly around the face, but also on the back, chest, and buttock areas. And in the hair, in the head, you can get thinning, but that's a very common symptom. So it's not usually linked directly just to polycystic ovaries. You can also get acne, and as I said, weight gain, and it makes it harder to lose weight. So that weight gain cycle is much harder. The diagnosis. Now, it's sometimes difficult to explain because it's not a condition like where, you'd go to a doctor and they would say, yes, I saw this on your scan, so you have this condition. It's a syndrome, which means it needs a combination of different things. So the general criteria is that if you need to have two or two out of three of the scan showing signs suggesting polycystic ovaries, so heavier ovaries, and other changes that they look for. You have to have either irregular or absent periods, so where you're missing periods, or you have to have excessive levels of androgens. And this might not just be in your blood test. It might not mean that your testosterone on your blood or other hormone levels are raised. It might just mean that you have all of these symptoms that suggest that you have excess levels of androgen. So 2 out of 3. So even if you don't have anything on ultrasound, but you have the other two, you could still get diagnosed with the condition. In terms of treatment, there isn't a cure, and it doesn't need treatment if it's not bothering you. So if it's something that's just picked up randomly or your symptoms are mild enough, you don't really need treatment. But if you do have the condition, you should get regular checks, particularly for your heart disease risk factors, because it is associated with something called metabolic syndrome, which increases your risk of heart disease and strokes later on. So regular blood checks, regular diabetes checks, and for the sake of the lining of your uterus, so your lining that sheds every month, if you're not getting a period at least once every 4 months, the risk of you getting cancer of that lining increases. So if you've got polycystic ovaries and you haven't had a period for 3 months, you should see your doctor and they can give you medication that will induce a bleed. So they will give you medication to cause you to bleed, and that will return your risk back down to normal. Okay, so it's just that prolonged lack of hormones that will cause that will cause your risk to increase. Okay, if you're already on hormones, like you've got a intrauterine device that releases hormones, or you're taking hormone tablets and not getting a period, that's okay. But if you're not on hormones and haven't had a period for 4 months, you should get a bleed induced. Okay. Okay, and then adenomyosis. So this condition is again very poorly diagnosed and it's very common. We're seeing it a lot more now. Um, I'm going to go into the picture first. So that picture that you can see, all those black dots, so that's in the muscle layer of the uterus or the womb. Those black dots represent the cells that you usually get in the lining of the womb or the uterus that sheds during your period. In someone with adenomyosis, those cells are actually growing in the muscle layer. So there's nowhere for that blood to escape to. It's not caused by infection and it's not contagious, but for some people it will cause no symptoms and have no effect on them. For others, it can cause a lot of pain, it can cause very heavy periods, and it can cause pain when you're having intercourse as well. It's usually we see it diagnosed more in women in their 40s and 50s, but we don't really know a lot about it in terms of, what makes people more prone to it. However, the good thing is it's not been related to cancer or cancerous changes at all. But depending on your symptom, it can really cause severe symptoms that affect your quality of life around the time of your periods, and sometimes for people beyond that. Okay. In terms of diagnosing it, usually it can be seen on ultrasound, but it might be in the early stages of the disease, it might not be seen. And the other way to diagnose it is a laparoscopy, which is a surgical procedure where they use a camera to look for it. Treatment-wise, there isn't a cure for it either. And the treatment, again, depends on the symptoms. So if you have no symptoms from it, it's just picked up on ultrasound, there's nothing that you need to do. If your symptoms are mild pain, then painkillers can be taken, hormonal contraceptives can be taken, and that can manage both the bleeding as well as the pain. And there's some links to show that a healthy diet and regular exercise will improve your symptoms as well. In people who the symptoms are really severe, then the only real cure for it is to get your uterus removed, so a hysterectomy, but it's not commonly done for this condition. Endometriosis, been a lot of press about this condition because it's very common and it was very underdiagnosed before, and I'll give you the reasons for it. But it's essentially similar to adenomyosis, except instead of this happen, the cells that form in the lining of the womb, instead of those happening in the muscle layer of the uterus, they're actually happening anywhere outside of the uterus. So you can see on this picture, those clumps of cells are actually growing outside of the uterus. And every month, the normal cycle changes that happen in the lining of the womb also happen in those cells. But because there's no way for that blood to escape, it kind of just develops into tissue, causing a lot of pain. Like the pain can be so severe that people end up in hospital every month because they're in such severe pain. Also, depending on where this is growing, it can cause something called scarring. It can cause different parts of the body to stick to one another and then cause pain and blockages and things like that. So there's a lot of potential issues with it. Um, it can cause constipation depending on if it's around your abdomen. You can get cramps in your legs, back pain. The symptoms are so wide and varied. And that partly also can be the reason why it's underdiagnosed. They did a study and found that it takes on average about 7 years from the time a woman goes in to see their doctor first about the symptoms that she's having to diagnosis of endometriosis. It can take an average of 7 years, which is a very long time. And the reason is because it's very easy to mistake it for other things. Um, and it also is difficult to see. So you can't pick it up on an ultrasound. It's very uncommon for it to get picked up on ultrasound. The gold standard used to be a laparoscopy where you get a cut in the abdomen and then they use a camera to have a look at the uterus and around the structures around it to see whether they can see any of these clumps of tissue. And when they do, they treat it at the same time. So usually they'll burn it off. But again, to take a woman into theater and for a surgical procedure without any testing, usually it used to take a long time for a specialist to even consider doing. And often, symptoms were ignored as just PMS and other things. So I think now there's a lot more information, there's a lot more knowledge. We also do tend to sometimes do MRIs if the suspicion is really high that it could be endometriosis. And sometimes it's just diagnosed based on the symptoms that you have. And that actually is okay to do. In terms of treatment, there isn't a cure. And sadly, even when it's been kind of burnt off through surgery when it was picked up, it can happen again. So treatment tends to be really difficult with this condition and its symptom control. So managing the pain, and that's not always as easy as it sounds. It can also cause people to get very, very heavy periods. So managing that, whether with hormones or with medication like something called tranexamic acid, which stops people from bleeding, but it's not a hormone. So sometimes people have to take that every month, every time they get their period, they have to take that to cause it to stop. Sometimes you need surgical procedures to go and burn out those areas. And for women who the bleeding is very heavy and it's affecting their function, and in the most kind of severe method, then they'll consider taking out the uterus or a hysterectomy for that. But again, it's not commonly done because there are other procedures that can be done before it, but it is a very debilitating condition. So if you feel that, what, my periods are extremely painful or heavy, it doesn't have to be both. And I feel like there's something going on, don't hesitate to bring up endometriosis or adenomyosis to your doctor and ask them, have you considered this? Can you look into it? Because, unfortunately, sometimes we do have to advocate for ourselves. Okay, so lastly, let's talk about fibroids or uterine fibroids. They're also called leiomyomas, and they're growths or tumors in the uterus, in the womb, but they're not cancerous and they don't develop into cancer. They're extremely common and they're often picked up when you have an ultrasound scan for a different reason. You might get called in and told that, okay, we've seen that you've got fibroids. So they might not actually be causing you any problems and you may not even know that they're there. You can have one, you can have multiple, and that the picture that I have there is just showing the different areas that the fibroids can be. So depending on where they are, they can cause different symptoms. For example, if you've got a really big fibroid that's projecting into or protruding into your uterus, into that lining, it can affect the your pregnancy from the point of view of the baby implanting into your womb, right? Because it's taking up space and it can affect the baby's growth. So there are different things that we do based on the symptoms that you have. again, you can either have no symptoms at all, or you can have very heavy periods. You can have painful periods. You can get this heavy feeling in the abdomen. Sometimes you can have an abdomen that looks like you're always pregnant, and that could just be a very, very large fibroid that's protruding and making it look like you've got a pregnant belly. If they're really large, the fibroids can push onto your bladder, which is just in front of your uterus, and so it can make you go to a feel have that sensation of wanting to pee every time your bladder has a bit of urine in there. And likewise, from the back, behind the uterus, you've got your bowels. So sometimes it can cause constipation because if it's pushing on the tube where you poo from, it might get stuck. It can also cause pain during sexual intercourse. Diagnosis, again, it's usually very commonly seen on ultrasound. They do sometimes use MRIs, and sometimes if they're really large, even when we examine them, we can feel them. Treatment, as I said, it depends on what symptoms you have. So it depends on the size of the fibroids you have and the symptoms. Size actually isn't a big issue in terms of treatment unless it's causing physical problems. So for most people, they just don't have any treatment. Lifestyle changes can make a difference because it's related to your hormones. And so if you're healthier, you're eating healthy, the idea is that your hormones are more balanced, it can make the chances of fibroids growing a bit better. Pain management, so if you're in pain, then painkillers are usually given. Hormones are usually used often to manage the symptoms. And usually an intrauterine device, which is like a T-shaped coil that's inserted into your uterus, and that slowly releases hormone. And that has been very effective in controlling both the pain and bleeding in these conditions. Actually, even in endometriosis, it's often used very effectively. And then in terms of surgical removal of these, there are different ways, either by cutting off the blood supply or actually just cutting off the fibroid itself. And then in very severe cases, hysterectomy as well, where they take out your entire uterus. Right? So that's just in a nutshell. That was what normal periods usually look like. And abnormalities when you need to see a doctor, and then a few conditions that are very commonly seen. I've got a few resources here that are quite useful in terms of a lot of these conditions. The Knowledge is actually a book by someone that I trained with in the UK, and it's really well written because it's not written for medical people, but it's got everything about the hormonal journey of a woman, and it's worth a read. If you are local, I have the book. If you'd like to get it off me, you're more than welcome to. But I'm open to any questions. I hope you found that useful. It's a really big topic and there's a lot to discuss. So it was really hard to kind of decide what to put and what not to put. Um, but yeah, please feel free to ask anything. There's a question on here. Can we have intercourse during menses and what are the chances of conception? So during your periods, you're especially in the first 5 days, you're not going to conceive because it's so far off from your ovulation that there isn't really any chance. So even if you're not using contraception during that time, you're not really going to conceive because the sperm usually survives for about 72 hours, and the egg, once it's released, it survives for 24 hours, right? So the best time to try to conceive is around your ovulation time so that you've got sperm already in the canal for the egg to fertilize with. But once ovulation has happened, 24 hours after that, you're not really that fertile. So during your period time, you're not going to conceive. Unless you're having irregular periods. So if sometimes people do bleed when they ovulate a little bit, and you might mistake that as a period, in which case, yes, you can get pregnant during that time. So it also depends on what your cycle is like. But during your actual routine period, you usually won't conceive. There's a question as well. Is it safe to have intercourse during menses? Since, as per Islam, we're not supposed to. So, I'm I can find out for you in terms of Islamically. I'm only going to comment though on medically. Okay, so in terms of safety, there isn't any information to suggest it's unsafe. I'm not going to comment in terms of Islamically because I don't have adequate knowledge to be able to do that. But if you'd like me to find out, I'm more than happy to get back to you on that. But in terms of safety wise, it isn't a risk, or at least there isn't any data showing that there's a risk at present. I'm gonna still be hanging around for a little while. If anyone has any questions, you can send them to me privately if you don't want everyone to see them on here, and then I'm happy to read them out, or feel free to unmute, and ask your questions.
Hi, Dr. Fatima. Can you
Hi.
share your contact information so I can reach out if in case if I need you for anything in the future?
Sure, I can put my number in the chat box, okay? Yeah, on that note, actually, for anyone who like is local, if you do ever bump into me, feel free to message me or to come and ask. I'm more than happy for you to reach out um with anything actually. Well, thank you very much for attending, and as I said, I hope you found it useful.